Okay, well, it's really great to be here in person. My name is Lauren Schmitz. I'm currently an assistant professor at UW Madison. And this is joint work with Valentina Duque, who's at the University of Sydney. And this is, I think, the first talk that's going to use DNA methylation data, but excited to see a lot of the other talks that are going to be coming up as well. So looking forward to some more conversation. All right, so we all know it's really challenging to study the causal effect of early life shocks on epigenetic modifications, in part because there's just not a lot of DNA methylation data out there yet that really allows us to look at this in more depth. So I would say that there's need for research that can identify sensitive or critical periods when the environment has its greatest impact on epigenetic aging signatures. So, what points in the life course are particularly salient for these long-run epigenetic aging signatures that we're seeing in older adults. So what we do in this study is we ask whether exposure to economic fluctuations in utero impacted late life epigenetic aging. And we're going to focus on the most severe and prolonged economic downturn in American history, which was the Great Depression. So why focus on the Great Depression? First and foremost, this was a massive, massive economic shock. A quarter of the US labor force was unemployed, fortunes were destroyed, and importantly, there was no social safety net at the time. So there were no food stamps, there were no prenatal vitamins, so women were particularly vulnerable, as were families. It was 4 to 5 times the size of the Great Recession, and it was a really huge unexpected shock. So you could say it was a pretty exogenous shock. And another thing that's very interesting about the Great Depression is that there was a lot of geographic and temporal variation in the kind of extent of the shock due to the Great Depression and, of course, the subsequent government relief programs from the New Deal. So what we're going to do here is exploit state and year level variation in macroeconomic conditions during the 1930s to identify the impact of the Great Depression on epigenetic aging. And what's really great here is the Health and Retirement Study has come out with a large pilot study of DNA methylation data, and it's the first nationally representative study with epigenetic data that has the geographic variation necessary that allows us to utilize and exploit these state-level differences in economic conditions at birth and into childhood. So this is one of the measures of the exposure that we're going to use. It's a wage index, so it incorporates farm and non-farm wages across states. And what you can see here is just there's really dramatic variation in kind of the extent of the wage index across states in the 1930s. So this is indexed to 1929 before the Depression. And you see there was this huge kind of decrease in wages, and then it picked up again during the New Deal era. I'll just quickly, I'm not going to spend too much time on this. We could talk more about it if you'd like in the discussion section. But basically, here we regress epigenetic age acceleration for individual I that was born in a given state and who had their blood taken in 2016. And then our main exposure of interest here, we're going to do event time study. So we're looking at the aggregate wage index at the state and year level for the period before conception. So we have a pre-trend in utero and then in early childhood. So we're going to look all the way up to age 16. And then we control for a number of state fixed effects, year fixed effects, region and year birth time trends, and a number of other important kind of state level characteristics that we need to account for during that time period. So here, this is not the event time study. This is just the wage index that you experienced in utero that we're seeing now in the Health and Retirement Study. As you can see, we only have 832 people that we can utilize that were born in the 1930s. So this is a small sample, but we're able to identify meaningful effects because we do see much larger effect sizes with epigenetics. Importantly, we see that this is concentrated during the utero period, and we only find effects in 2 of the clocks. So some of these more recent second generation clocks, the GrimAge and the PoAm clock. Here what we see is that a 1 standard deviation increase in the wage index in utero led to about a 0.3 standard deviation decline in epigenetic age acceleration and in GrimAge and PoAm. And that's a large effect. So 1 standard deviation of the wage index is equivalent to only about 80% of the overall decline that was experienced with wages during the Great Depression. So this, I think, is very striking. This is the full event time study specification. So this is a fully specified model. We have the pre-trend in there. We have the in utero coefficient, and then we have coefficients all throughout childhood. So for each person, we have up to age 16. These are all in the model, and you see that the only effect where we see higher wages, better outcomes was during the in utero period. So again, these are on long-term epigenetic aging signatures when people are 75 plus in health and retirement study. So I didn't get a lot of time to talk about the sample, but we can talk more about that later. This is the same for the Dunedin PoAm. So also just seeing the effect concentrated during the in utero period. So just to wrap up, we find that economic fluctuations from the Great Depression increased epigenetic age acceleration among individuals who survived until 2016, who had their blood taken in 2016. Those were people in the HRS who were about ages 75 to 85, so who were born during the 1930s, who lived to have their blood taken in 2016. The effects of the shock appear to be linked to exposures during the in utero period only. We don't find any evidence at any other time period in childhood. And I didn't have time to talk about this today, but yes, the big elephant in the room is mortality selection. And we did a number of different tests to look at mortality selection. We also looked at other selective responses, so endogenous fertility, what kind of mothers were having children during this time period, how did those affect our results? And if anything, we found that all those different selective responses bias our coefficients downward. So sicker people died earlier, they weren't captured in the HRS. And we also see during the Great Depression time period that more advantaged mothers, higher SES mothers, were more likely to have children. Again, so if we look at the research on maternal education and health, those children are also more likely to be healthier. So again, if anything, we find that our coefficients are on the low end of what perhaps could be had we seen the entire population. We also find that our results aren't driven by the Dust Bowl, which was another huge ecological catastrophe during the time, New Deal spending, or World War II mobilization. So happy to talk more about those things as well. And thank you. I'm trying to get more followers on Twitter. So, and that's my email if you have questions. And yeah, looking forward to talking more with you all. Thank you.